Thanks so much for joining us for DermTube Daily Coverage. I'm Joel Cohn, and we're broadcasting live from Maui Dermatology 2015. And with us this morning is Hayes Gladstone, who's a Mohs surgeon and dermatologic surgeon in Northern California. So Hayes gave a discussion on non-surgical treatments for non-melanoma skin cancer. Can you tell us a little bit about your presentation?
Great, Joel. Well, first of all, thank you for inviting me, and it's a great meeting. The title of my talk was Disruptive Technologies for the Treatment of Non-Melanoma Skin Cancers in the 21st Century. And I focused on something called electronic brachytherapy and also superficial radiation.
So we're both Mohs fellowship trained surgeons. We see people every day with complicated skin cancers, and we know firsthand that surgery works and works really well for these people. So when are you employing these types of modalities?
Well, as you know, Mohs surgery is still the gold standard for the treatment of non-melanoma skin cancer, and for primary basal cell skin cancers it has over a 98% cure rate, and for squamous cells it's probably around 97% cure rate. So it is the gold standard and the most common treatment. However, being an aesthetic surgeon and dermatologist yourself, everything is becoming more non-invasive. And basically, radiation therapy has been around for many decades, but in the past it was kind of the purview of radiation oncologists because you needed vaults and you needed to do it in special facilities. But recent breakthroughs in technology have allowed these procedures to actually be performed in dermatology offices. And basically, electronic brachytherapy is an offshoot of brachytherapy and high-dose brachytherapy, but it doesn't use what is called a radium, which is the isotope. It uses something that is not iridium, so therefore it's allowed to be used in an office with some shielding, but without a lead vault. And it has been shown, at least in some preliminary studies, to have approximately a 98% cure rate for non-melanoma skin cancer. Now, superficial radiation is a little bit different in that electronic brachytherapy needs to be performed by a radiation oncologist in a dermatology office. However, superficial radiation can be performed by the dermatologist with the assistance of a radiation therapist. And that has been around for many decades too. It's more superficial and it uses photons rather than charged particles. And again, you don't need extensive shielding or lead walls to perform it in your office. And it has a cure rate in the mid-90s in terms of percent for non-melanoma skin cancer.
So Hayes, can you tell us a little bit about the patient population that you're treating? I know every day that I operate on a big skin cancer on the shin, I'm concerned about the healing process. Whether I put on a graft or I let the area granulate, I know that that wound is something that we need to pay particular attention to, and it's going to take a while to heal. Is this the patient population, older non-surgical candidates on the shins, or are you treating various areas even in younger, healthier patients?
Well, currently, as you mentioned, Mohs surgery is the gold standard, but the niche for these two technologies are exactly what you said. Right now, at least, it's most appropriate for the older patient who's frail, who may not tolerate surgery very well, may be on anticoagulants where bleeding may be an issue, where there is a skin cancer, as you mentioned, on the shin, which may be very poorly healing and may have a better chance to heal with the superficial radiation or electronic brachytherapy. In areas potentially, say, on the eyelid, where a large tumor, it may require extensive reconstruction, this may be an option. Currently, it's being used, these treatments are being used for the Medicare population. In the future, as more studies come out with longer longitudinal studies to truly determine if the cure rates hold up over 5 to 10 years, I strongly believe that it will be one of the mainstays, this superficial radiation and electronic brachytherapy, in our armamentarium for treating patients young and old. We're not there yet. Again, just like in cosmetic dermatologic surgery, everything is becoming non-invasive. So the advantages of these two technologies is that there are no needles, there's no pain. It really takes 5 minutes or less to actually do the treatment. It's outpatient. The scarring is different than with Mohs scarring. As you know, with radiation, over time there may be hypopigmentation, but it seems to be well tolerated by the patient population, and there, at least in my anecdotal experience, there is very high patient satisfaction. So for people who are very active and don't want any downtime, there's no bandages, this is a very appealing alternative, and it may be more so in the future. The disadvantages are really a couple. One, unlike Mohs surgery, it does not check the margins. There's a field, they usually go, the radiation oncologists will mark maybe 5 millimeters around the tumor, but there's no margin control like Mohs surgery. And then the other downside is that it can take maybe 10 treatments or more, 10 to 12 treatments to achieve cure. And so that means the patient has to come twice a week, say, for 5 or 6 weeks. They are very short appointments and there's no downtime. But again, those are...
Tell us a little bit about cost.
Okay. Cost right now, it is much more, electronic brachytherapy is a more complex procedure because it involves radiation oncologists, physicists, and radiation therapists. So it's a whole multidisciplinary team. And they come into the dermatologist's office, and the cost right now is significantly more expensive than Mohs surgery because you have this multidisciplinary team and this very expensive, quite honestly, expensive technology and the energy source. And that probably will change over time, I'm sure. But in contrast, superficial radiation, the reimbursement is much, the cost of the machine is still fairly expensive, like a laser, but the reimbursement or the cost of the patient is less. So it's significantly less, and the dermatologist is the one who's coding and doing those procedures.
You differentiated this type of radiation from some of the other types of radiation that's out there. We as Mohs surgeons see people every day who had acne treatments and had radiation for acne in the 60s and 70s who now have many skin cancers. So for the folks out there who hear radiation and are worried about long-term follow-up and some of the issues in that area, can you comment on that for us, please?
Sure. Again, I would like to reiterate that these two technologies, electronic brachytherapy and superficial radiation, are more targeted and much more superficial than electron beam or orthovoltage, which are the traditional radiation procedures, which are effective, but as you mentioned, they have a lot of collateral damage to the skin and can cause changes that may lead to skin cancer. So far, that has not been the case, again, because these are very focused beams and superficial, so there's not as much skin change. There is some skin change, and one of the issues, too, is that with this technology, just like the older technology, if there is a recurrence, then there is skin damage, and it may be more difficult to repair in the future.
So keeping cost in mind and understanding the limitations of some of these long-term follow-up, this is probably, again, best used in older patients who may not be surgical candidates, particularly in areas that may be harder to heal, like the lower extremities.
Yes, I think it is a good technology right now, a interesting technology that has for the appropriate patient and selected patient, it works. Right now, it's a very small population. I would say 10% of the patients, as a ballpark figure, probably are appropriate for these types of therapies. In the future, that may change as we get more long-term studies and then changes in reimbursement where the societal costs are not as high. So I am excited about these technologies. But right now, I totally agree that it's only for those selected patients that you mentioned.
Thanks so much for joining us for DermTube Daily coverage from Maui Dermatology. See you next time.